You may have seen the headlines recently claiming that acetaminophen use during pregnancy causes autism. That's a powerful, scary statement, but what does the research actually show? Hi, I'm Dr. A. I'm a psychiatrist and lifestyle physician. Before we dive deeper, let's define what autism actually is. Autism spectrum disorder, or ASD, is a developmental condition that affects how a person communicates, interacts, and experiences the world. The spectrum part means it shows up differently for everyone. Some individuals may encounter difficulties with social connections or interpreting social cues. In contrast, others may struggle with sensory sensitivities, repetitive behaviors, or a limited range of interests. Some individuals are highly verbal and live independently, while others may be non-speaking and require significant support. Autism isn't a disease, it's a difference in how the brain processes information and responds to the environment. Many individuals with autism have exceptional strengths in areas such as pattern recognition, creativity, or mathematics. Symptoms often become noticeable in early childhood, typically before the age of 3. Some milder forms may not be recognized until later. Understanding autism as a neurodevelopmental variation rather than a single disorder shows why pinpointing a single cause is incredibly complex. Some studies have found an association between acetaminophen use during pregnancy and increased risk of autism spectrum disorder. But is association causation? If you took acetaminophen during pregnancy, these headlines of Tylenol being linked to autism may make you wonder if you hurt your child, especially if your child has a developmental disorder like ADHD or autism. But the science is far more complex than any headline suggests. One evidence comes from a study that measured actual acetaminophen levels in umbilical cord blood. Mothers in the highest third of acetaminophen levels had a 3.6-fold higher risk of having a child with autism compared to those in the lowest third. According to the CDC, the baseline risk of autism is roughly 1 in 31 children aged 8 years. If acetaminophen doubles or triples that risk, we're talking about 2 or 3 children out of 31 instead of 1. Still concerning? Absolutely, but it's not the epidemic level risk the headline suggests. Of course, our preference will be 0 and not even 1 in 31. But here's something else. A massive Swedish study of 2.5 million participants found that when they controlled for family factors using sibling analysis, the association between autism and Tylenol disappeared. What does this mean? It suggests that other factors, such as genetics, family environment, or shared exposures, might explain the connection. But this study had a critical limitation that most people missed entirely. And here's another piece most headlines ignore. The acetaminophen autism link appears much stronger in male children than female children. Multiple studies have shown that boys are far more vulnerable to environmental stresses during brain development. This includes not just acetaminophen, but also BPA, air pollution, and other chemical exposures. Why does this matter? Because the Swedish study didn't separate results by gender. The protective effect in girls might have diluted the risk signals in boys, making the overall association disappear. It's like averaging the temperature in Alaska and Texas and concluding the weather is mild everywhere. But there's more to the story. Some studies show that respiratory infections during pregnancy increase the risk of autism. Think about why people take Tylenol during pregnancy. Fever, pain, feeling sick. Fever has been shown to affect the developing brain of a baby. Infections in the mom can trigger inflammatory processes that cross the placenta. When your immune system fights an infection, it releases inflammatory molecules like cytokines. This can cross the placental barrier and affect fetal brain development during critical windows. So the question becomes, is it the medication or the underlying illness that drives the risk? This is referred to as a confounding variable, and it's why interpreting medical research requires nuance. Pain and fever during pregnancy aren't harmless. They can raise stress hormones like cortisol and increase inflammatory molecules called cytokines, both of which affect the developing baby's brain. With medications, many physicians recommend judicious use, the lowest effective dose for the shortest necessary time. It is essential to discuss all medications with your doctor. Some imagined research also suggests that nutrient deficiencies like low omega-3 fats, selenium, or antioxidants may make a developing brain more vulnerable to environmental toxins or oxidative stress. Supporting your body's detoxification and repair systems through nutrient-dense foods, adequate hydration, and minimizing unnecessary chemical exposures may help mitigate these risks. This is why lifestyle medicine is vital in prenatal care. Quality sleep, stress reduction, anti-inflammatory nutrition, and movement all help regulate inflammation and hormone balance. The bigger picture is this. No single exposure determines a child's future. The brain develops through a complex interplay of genetics, hormones, nutrition, and environment. So if you're a mom who took Tylenol in pregnancy, your brain is probably spinning right now. So should I have suffered through that fever? Should I have risked my health? Here's the thing. You didn't know then what we're learning now, and the science is far more complex than any headline suggests. Scientists have proposed several ways in which acetaminophen might affect fetal brain development. One theory involves aromatase, an enzyme crucial for converting testosterone to estrogen in the developing brain. Acetaminophen may interfere with this process, potentially affecting brain development, especially in male fetuses who rely more heavily on this hormonal conversion. Another thing to note is that we also have studies showing no dose-response relationship. If acetaminophen directly causes autism, we'd expect higher doses to create a higher risk. Many studies don't find this pattern. If you're deriving value from this video, subscribe to this channel so you don't miss out on future educational content. Let me share something you may not have considered. As our medical system improves, we're seeing an increasing number of children with developmental differences. 20 years ago, many high-risk pregnancies ended in loss. Today, we see babies who experience placental ruptures, brain bleeds, and severe infections. We're also dramatically better at diagnosing autism spectrum disorders. Many adults have been diagnosed for the first time in their 40s and 50s, people who would have been labeled quirky or odd decades ago. Maternal age is another factor. Women are having children later, and both maternal and paternal age increase the risk of autism. The average age of first-time mothers has risen by 5 to 6 years since the 1970s. College education increases the diagnosis of autism, not because education causes autism, but because educated parents often have children later and are more likely to recognize autism traits and get a diagnosis for the children. Many scientists believe that inflammation plays a role in autism spectrum disorder. Studies have shown higher levels of inflammatory markers and immune system dysregulation in people with autism, and maternal inflammation during pregnancy is linked to higher autism risk in the child. Now, this doesn't mean inflammation is bad. It's your body's protective response. But chronic or excessive inflammation during pregnancy might affect fetal brain development. Think of it like construction noise during a delicate recording session. The noise isn't inherently harmful, but the timing matters. Also, here's what the acetaminophen headlines don't mention. SSRIs, antidepressants like Zoloft and Prozac, also show an increase in autism risk in some studies. Air pollution, vitamin D deficiency, and advanced paternal age all show associations with autism risk. These factors are considered environmental risks that can affect brain development, though not every child exposed will develop autism. It's a complex web of factors, not a single cause. Autism likely results from complex interactions between genetics and the environment. There are many associations and predisposing factors, but studies have not identified a specific direct cause. It's like a house fire. Was it the candle, the gas, or the dry conditions? Usually, it's all three. If you're a mother watching this, carrying guilt about choices you made decades ago, please do not feel guilty. You loved your child enough to seek medical care when you were suffering. You followed medical advice. You did nothing wrong. If you have a child with autism, your love, support, and advocacy matter. In the meantime, further research is needed.